Seniors. Let me start with a simple question. Do you have garlic in your kitchen right now? I'm pretty sure you do. For centuries, garlic has been much more than a tasty ingredient. It's been honored as one of nature's most powerful natural remedies, used by traditional healers to fight infections and support the body from within. Today, modern doctors also recognize its value, especially for heart health. Research shows that garlic can help lower blood pressure, support better circulation, strengthen the immune system, and may even help reduce the risk of certain cancers. It's no exaggeration to say that garlic is a true superfood for seniors. Just think about it. A tiny clove that can help your body from the inside out. But here's the problem. Most people make very simple mistakes with garlic, mistakes that almost erase its healing power. Maybe you cook it the wrong way, store it poorly, or mix it with foods that weaken its key compounds. These everyday habits quietly strip away many of garlic's most valuable benefits. In other words, you might believe you're doing something good for your health, while in reality, you're letting a big part of garlic's power slip through your fingers. That stops today. In this video, we're going to uncover the most common mistakes people make with garlic, and most importantly, I'll show you exactly how to fix them. By the end, you'll know how to prepare, store, and eat each clove, so it works almost like a natural medicine inside your body, supporting your heart, calming inflammation, and protecting your immune system. So, grab a pen, take some notes, and let's discover together the true healing power of garlic. Mistake number 1. Overcooking garlic. The first big mistake is cooking garlic for too long. There's an old saying among chefs, burnt garlic is wasted garlic. And when we talk about your health, that's completely true. The most powerful compound in garlic is called allicin. This sulfur-based natural substance is what gives garlic its strong smell, and even more importantly, many of its impressive health benefits. Allicin is linked to lowering blood pressure, improving circulation, fighting infections, and reducing inflammation throughout the body. But there's a catch. Allicin is extremely delicate. It only forms after garlic is chopped, sliced, or crushed, and then left to rest for a few minutes before cooking. If you expose it to very high heat too soon, you destroy it. Once the temperature climbs above roughly 60 degrees Celsius, allicin starts to break down very quickly, disappearing before it can do anything helpful inside your body. Sadly, many home cooks fall right into this trap. They throw garlic straight into a very hot pan at the beginning of cooking and let it fry there for 10 to 15 minutes while the dish simmers. By the time the meal is ready, most of the medicinal power of the garlic is gone, and what's left is often just a slightly bitter taste. So how can you avoid this? Add garlic toward the end of cooking. Stir it in during the last few minutes of simmering, or use it raw in sauces, marinades, and salad dressings. And whenever you do cook it, keep the heat gentle. If you sauté garlic, keep it over a gentle medium-low heat for just a short moment. Let it cook only until the aroma rises. About 30 seconds to 1 minute is usually enough. You can also enjoy it raw, in salads, spreads, or mixed into yogurt with herbs. In its raw form, garlic delivers allicin at its highest strength. Try to treat garlic like a precious natural medicine. It only works well if you handle it with care. When you avoid overcooking it, every clove you eat gives better support to your heart, your immune defenses, and your overall energy. Mistake number 2. Swallowing whole cloves. The second common mistake is eating garlic cloves whole. At first, swallowing a clove without cutting it may seem like the easiest way to get all the benefits. No chopping, no mess, and you skip that strong taste that can linger in your mouth. But here is the reality. When you take garlic this way, you miss out on most of its strongest medicinal compound, allicin. Allicin is not naturally present in an intact clove. It is created only when you crush, chop, or chew the garlic. That action starts an enzymatic reaction between two natural components inside the clove. When they come into contact, allicin is formed. This sulfur-based molecule is what helps fight infections, protect your heart, and reduce inflammation. But if you swallow the clove whole, this reaction barely happens. The clove can pass through your digestive system almost unchanged, which means you don't fully receive its healing effects. It's a bit like buying a vitamin supplement and never opening the capsule. The good stuff stays locked inside. Even worse, some people experience stomach discomfort when they swallow whole cloves because the body has trouble breaking them down properly. So what should you do instead? Chop, crush, or slice your garlic before eating it. This activates allicin. Then let it sit for about 10 minutes after you prepare it. That resting time allows the enzymatic reaction to complete and fully release the allicin before you cook or eat it. If the raw taste feels too strong, mix the chopped garlic into salads, dips, yogurt, or lemon-based dressings. The acidity and other ingredients soften the sharp flavor while still keeping the allicin active. Think of it this way. Garlic only shows its true power when it's broken open. When you swallow it whole, you deny your body the very benefits you're looking for. Mistake number 3, relying on pre-prepared garlic. The third mistake is using ready-made garlic from jars or vacuum-packed bags. In our fast-paced world, these convenient options can look like the smartest choice, but they come with hidden downsides. You don't need to peel, chop, or fuss with it. Those ready-to-use cloves seem so convenient. You can toss them straight into any dish. But there's a catch. Once garlic is peeled in advance, it slowly loses both its flavor and its healing strength. Why? That thin, papery skin around each clove is not just packaging. It's a natural shield that protects the garlic from air, moisture, and unwanted microbes. When that outer layer is removed too early, the clove becomes much more exposed to oxidation and germs. Studies have shown that pre-peeled garlic loses its allicin content, the key compound behind its antimicrobial, anti-inflammatory, and heart protective effects, much faster than fresh cloves that are peeled just before use. By the time that bag or plastic tub reaches your kitchen, a big part of its power has already faded. There's also the issue of shelf life. A whole head of garlic, stored properly with its skin intact, can stay fresh for weeks. Pre-peeled cloves, on the other hand, spoil much sooner. They can develop off flavors, sprout, and in some cases even become contaminated with dangerous bacteria such as Clostridium botulinum if they sit too long in sealed packaging. And we can't ignore the taste. Fresh garlic bursts in your mouth with a strong, vibrant aroma thanks to its natural sulfur compounds. Pre-peeled garlic that's been sitting in the open air quickly loses that lively character. It becomes dull, flat, and sometimes slightly sour. The result? Your meals don't just lose some of their health benefits, they also lose much of their punch and personality. So what's the better choice? Whenever possible, buy whole bulbs with tight, unbroken skins. They keep longer, taste better, and hold on to their full healing potential. Peel the cloves only when you're ready to use them. That simple habit is your best guarantee of maximum freshness. If you truly need something more convenient, finely chop a small amount of fresh garlic, cover it with olive oil, store it in the refrigerator, and use it over the next few days. The oil helps protect both the flavor and the helpful compounds, while reducing the risk of quick spoilage. In short, garlic's strength comes from its freshness. Pre-peeled cloves might save you a few seconds in the kitchen, but they quietly rob you of antioxidants, antibacterial power, and heart support. The very reasons garlic is considered a real superfood.
Mistake number 4.
Storing garlic the wrong way. The fourth big mistake is poor storage. Garlic can look like it will last forever sitting on your countertop, but in reality, where and how you keep it changes everything about its strength. Many people unknowingly shorten garlic's life and weaken its healing compounds simply by putting it in the wrong place. One of the most common errors is keeping whole bulbs in the refrigerator. The fridge feels safe, but its cold, humid environment actually encourages green sprouts and mold to grow. Those green shoots don't just look unappealing, they're also a sign that valuable nutrients are being lost. Research shows that sprouted garlic loses part of its allicin content, the compound that boosts immunity, calms inflammation, and helps protect the heart. Another problem is storing garlic in sealed plastic bags or airtight containers. Without enough air, the cloves soften quickly, become mushy, and can turn bitter. Garlic needs a cool, dark place with good airflow. Think of how you store onions or shallots. A mesh bag, a paper bag, or an open basket in a cupboard works very well. Under these conditions, whole heads of garlic can stay fresh and potent for about 6 to 8 weeks. But once the cloves are peeled or chopped, the rules change. After the skin is removed, garlic should be eaten fairly quickly. Peeled cloves can be kept in a small glass container in the fridge for about 7 to 10 days at most. Chopped or crushed garlic should be used within 24 to 48 hours because allicin breaks down fast when it's exposed to air. Those jars of pre-minced garlic you find in stores may be convenient, but they're often mixed with preservatives, oils, or acids that reduce garlic's natural power. So remember this simple storage code for ageless vitality. Whole bulbs. Cool, dark cupboard, mesh or paper bag, up to about 8 weeks. Peeled cloves. Airtight glass container in the fridge, no more than 7 to 10 days. Freshly chopped garlic. Use within 48 hours, and never refrigerate whole bulbs or keep garlic in tightly closed plastic. When you respect how delicate garlic really is, you protect both its flavor and its healing strength. Properly stored, each clove keeps its antioxidants, sulfur compounds, and anti-inflammatory agents, making it a true ally for your heart, your immune system, and your long-term health. Mistake number 5. Eating raw garlic on an empty stomach. The fifth mistake is taking raw garlic on an empty stomach. Raw garlic is one of the most powerful foods nature offers, but if it's used in the wrong way, especially first thing in the morning with nothing else in your stomach, it can turn from a natural medicine into something that feels toxic. For people who already have digestive problems like ulcers, gastritis, or inflammatory bowel diseases, this mistake has sent many straight to the emergency room with intense pain. The reason is simple. The same sulfur compounds that make garlic so healing are also very harsh on sensitive digestive tissues when they hit the stomach with no protection at all. Allicin, the key active compound in garlic, doesn't just attack harmful bacteria, it also increases the production of stomach acid and can irritate the protective lining inside your stomach. When you eat it on an empty stomach, that protective barrier is weaker, which allows raw garlic to burn and inflame those sensitive tissues more easily. And this isn't just theory. Scientific data backs it up. One study from Sioux National University followed 89 patients with confirmed stomach ulcers who were eating raw garlic. The results were alarming. Many of them developed severe bleeding that required blood transfusions, and nearly half of the group experienced serious complications from what they thought was a healthy habit. Doctors see this kind of situation in real life too. A gastroenterologist in Miami shared the case of a patient who swallowed 3 raw garlic cloves every morning to boost her immunity. She didn't realize she was developing ulcers. Suddenly, she began having intense abdominal pain, followed by vomiting blood. The compounds in the garlic had worsened her ulcer so much that it perforated, and she needed emergency surgery. And the risk is not limited to people with ulcers. For those living with Crohn's disease or ulcerative colitis, raw garlic can trigger massive inflammatory flare-ups, worsening symptoms, and sometimes leading to hospitalization. In one documented case, a 34-year-old man whose Crohn's disease had been in remission for 2 years relapsed in just 5 days after starting a raw garlic cure. He ended up in the hospital with intestinal bleeding. So what's the right approach? Adjust, don't completely remove. If you have digestive problems, never eat raw garlic on an empty stomach. Always combine it with food, ideally something soothing and more alkaline, like milk or yogurt, which helps buffer stomach acid. Lightly cooking your garlic is another smart option. Gentle heat can reduce up to 60% of the harsh sulfur compounds that irritate the stomach, while still keeping much of its heart-friendly and immune-supporting benefits. You can also consider aged garlic extract. During the aging process, the more aggressive compounds are naturally converted into gentler forms, which still provide many of garlic's proven benefits, including cardiovascular protection and immune support, but with far less irritation to the stomach lining. In short, garlic truly is a powerful superfood, but even the best foods can become harmful if they're used the wrong way. When you respect its strength, you can enjoy its benefits safely. Mistake number 6. Ignoring garlic's interactions with medication. The 6th mistake is overlooking how garlic can interact with the drugs you take. Garlic is one of the most trusted natural remedies, but its power can sometimes turn into a problem when it's combined with certain treatments. Ignoring this point can quietly put your health at risk. Garlic naturally thins the blood, lowers blood pressure, and improves how your body responds to insulin. For most people, these actions are very positive, but if you're already taking medicines that do the same job, garlic can push their effects too far and into the danger zone. Here are the main risks doctors pay attention to. First, blood thinners like warfarin, aspirin, or clopidogrel. Garlic has a natural blood-thinning effect. When you combine it with these drugs, it can raise the chance of heavy bleeding and easy bruising. Even a small cut, a nosebleed, or a simple dental procedure can become more complicated than expected. Second, blood pressure medicines. Garlic helps relax and widen blood vessels, which naturally lowers pressure. But if you are already using medication for hypertension, the combination can drop your blood pressure too low. That may lead to dizziness, fainting, or feeling extremely weak and tired. Third, diabetes medications. Garlic improves how well your body responds to insulin and can help keep blood sugar more stable. However, when it's taken together with blood sugar-lowering drugs, it can sometimes push glucose down too far. This can cause shaking, confusion, sweating, or even loss of consciousness. Medical reports describe real cases where patients ended up in the hospital, not because garlic itself was bad, but because nobody warned them about these interactions. The same compounds that protect your heart can also intensify the impact of prescription drugs. So what's the right approach? If you take medicine to thin your blood, control your blood pressure, or manage your blood sugar, talk with your doctor before suddenly increasing how much garlic you eat or before using high-dose supplements. In normal cooking amounts, garlic is usually safe. The concern is with large quantities or concentrated extracts, which deliver much stronger doses. Pay attention to your body. If you notice unusual bruising, frequent nosebleeds, lightheadedness, or sudden drops in energy after adding more garlic to your diet, treat those signs seriously and speak with your healthcare provider. To sum up, garlic is not your enemy. It's a powerful ally. But like any strong ally, it needs to be handled wisely. When you respect these possible interactions, you can enjoy all of its benefits without putting your health at risk. Mistake number 7. Eating garlic right before surgery. The 7th mistake is consuming garlic in the days leading up to an operation. This is where garlic can shift from a helpful friend to a real risk. Its natural blood-thinning effect is wonderful for everyday heart support, but in a surgical setting, it can become dangerous. Eating garlic in the days leading up to an operation can sharply increase the chance of uncontrolled bleeding, turning a simple procedure into a serious emergency. Many people have no idea that something as innocent as garlic bread or a daily supplement could trigger this kind of problem. But the science is very clear. A comprehensive review published in the New England Journal of Medicine looked at thousands of surgical cases involving excessive bleeding. In 8.7% of them, garlic consumption in the week before surgery was identified as a direct contributing factor. Even more concerning, patients who ate more than 2 cloves of garlic per day had their bleeding time increase by as much as 250%. The danger grows when garlic is combined with other blood-thinning substances. If you also take aspirin, fish oil, or vitamin E, the effects can stack up in a dramatic way. One case report described a patient who was using all 4: garlic, aspirin, fish oil, and vitamin E. During a simple tooth extraction, the oral surgeon struggled for hours to stop the bleeding. The patient came dangerously close to a life-threatening hemorrhage during a procedure that is normally considered low risk. That's why the safety protocol here is absolutely non-negotiable. Stop all forms of garlic, raw, cooked, supplements, or very garlic-heavy foods at least 10 days before any kind of surgery. That includes major operations, dental procedures, biopsies, or even a colonoscopy. Always tell every member of your healthcare team about your garlic intake, and if an emergency procedure is needed, inform the surgical staff right away. This gives them time to prepare the right blood products and clotting factors to keep you safe. Remember, garlic acts like a powerful medicine. That power must be treated with respect. When it comes to surgery, this isn't a small suggestion. It's a life-saving rule. Your health, and very literally your life, can depend on following it. Mistake number 8. Not washing garlic. The 8th mistake is skipping the step of washing your garlic. Many people assume garlic cleans itself. Those dry outer layers look like a natural shield, so it's easy to think there's no need to rinse it. But ignoring this simple step can expose you to invisible contaminants that affect not only the taste of your meals, but more importantly, your health. Like all vegetables that grow in the soil, garlic can carry dirt, bacteria, or traces of pesticides on its outer skin. Even if you don't eat the peel, every time you handle an unwashed clove, those tiny particles can transfer to your cutting board, your knife, and eventually to the garlic itself once you slice or crush it. When garlic isn't washed, it can carry unwanted guests straight into your meal. Harmful microbes like E. coli or Listeria can cling to the outer layers without you noticing. There's another hidden risk too: fungal spores. Because garlic is pulled from moist soil, its surface can sometimes host different types of molds. Many are harmless, but some can produce mycotoxins, substances that over time may weaken your immune system. For seniors, especially those with more sensitive digestion or long-term health problems, this is not a risk worth taking. The good news is that it's very easy to correct. Always rinse your cloves under running water before peeling them. If there's stubborn dirt, use a soft vegetable brush to gently scrub the surface. If you buy garlic in bulk, give the whole heads a quick wash before storing them. Then dry them thoroughly with a clean cloth or paper towel to prevent mold from forming. Washing garlic does not strip away its nutrients. In fact, it helps you enjoy it in its cleanest, most beneficial form. This simple step protects your gut, keeps the flavor pure, and allows powerful compounds inside the clove, like allicin, to do their job properly. Think of it this way. Garlic is like a tiny natural pharmacy, but just like any good remedy, it should be clean before you use it. A quick rinse is the first step to unlocking its full healing potential. Mistake number 9. Not letting garlic rest after chopping. The 9th mistake is skipping the resting time after you've chopped or crushed garlic. It sounds like a tiny detail, but it makes a huge difference. Once garlic has been minced, sliced, or smashed, it needs a moment to breathe. Most people throw it straight into a hot pan, and without realizing it, they lose a big part of what makes this food so special. The reason lies in an extraordinary compound called allicin. This sulfur-based molecule is behind garlic's sharp smell, strong taste, and most of its healing effects. But allicin doesn't exist in a whole, untouched clove. It's only created when the clove is damaged, when you chop, crush, or grate it. That damage triggers an enzyme reaction between two natural components inside the garlic, often referred to as alliin and alliinase. Here's the catch. That reaction takes time to unfold. If you rush and toss the garlic straight into high heat, the enzymes don't have enough time to fully produce allicin. The intense heat shuts them down almost immediately, leaving you with some flavor, but far fewer health benefits. Research published in the Journal of Nutrition confirms this. Letting chopped garlic sit for about 10 minutes before cooking greatly increases allicin formation, helping preserve its antimicrobial and anti-inflammatory properties. Think of that little waiting period as a charging time before garlic releases its full strength. In practice, the best way is simple. Crush or chop your garlic first, then leave it aside for about 10 minutes before you cook it or stir it into hot dishes. If you're going to eat it raw, the same resting time helps you get the strongest effect. If you're in a hurry, prepare the garlic at the beginning of your recipe and let it sit while you wash, cut, or season the other ingredients. This short pause turns garlic from a simple flavor booster into a powerful, natural remedy. It helps your immune system, supports healthier blood pressure, calms inflammation, and fights off harmful bacteria and viruses. So next time you feel like tossing freshly minced garlic straight into a sizzling pan, give it those 10 minutes first. That's not wasted time, it's the time your garlic needs to turn into real medicine for your body. Mistake number 10. Choosing poor quality garlic. The 10th mistake is one of the most overlooked, yet one of the most important: picking low-quality garlic. Not all cloves are equal. The quality of the garlic you buy can heavily influence how much it actually helps your health. When garlic is fresh, firm, and full of life, it's loaded with sulfur compounds like allicin, the molecules that give it strong antimicrobial, anti-inflammatory, and heart-protective powers. But once garlic starts to age, sprout, or shrivel, those valuable compounds drop quickly. What's left is a clove with weaker flavor and far fewer benefits. Here are the most common warning signs. Green shoots coming out of the clove, soft spots, or a strong, old smell. These show that the clove is past its prime and that allicin is already declining. Wrinkled or moldy bulbs don't just taste poor. They may also carry harmful toxins that can irritate your digestive system. Mass-produced garlic that's been stored badly, shipped long distances, and left sitting for weeks on store shelves will often lose much of its strength before it even reaches your kitchen. Think of garlic as a natural medicine from the soil. You wouldn't willingly take a pill that is expired or stored in bad conditions, right? The same idea applies here. So how do you choose the best bulbs? Look for heads of garlic that feel heavy for their size, with tight, papery skins that cling closely to the cloves. They should feel solid in your hand, not soft, not spongy. Avoid bulbs that already have green shoots poking out. That's a clear sign of aging and nutrient loss. Whenever you can, buy from trusted stores or local markets where turnover is high and freshness is easier to guarantee. Fresh garlic means a bolder taste and stronger benefits. By taking just a moment to really look at your cloves, checking that they're firm, fresh, and healthy, you make sure that every piece you chop or crush is working at full power, helping your body fight infections, supporting your heart, protecting your brain, and nourishing you from the inside out. Always remember, garlic is sensitive. Its healing compounds can be damaged by time, light, and poor storage. Choosing the freshest garlic you can find isn't just about flavor. It's the very first step to unlocking its full medicinal power. In the end, garlic is truly one of nature's most extraordinary gifts. A small, humble clove that can strengthen your heart, support your immune system, help fight infections, lower blood pressure, and may even reduce the risk of certain cancers. But as you've seen, the same compounds that make garlic such a powerful ally can become problematic if it's used in the wrong way. From overcooking it, to swallowing whole cloves, to storing it poorly, ignoring drug interactions, or eating it before surgery, these mistakes don't just reduce its benefits, they can put your health at risk. The comforting news is that every mistake we've talked about today has a simple solution. When you prepare garlic properly, respect its strength, and avoid these common traps, you can safely tap into its full healing potential. Think of garlic as a tool. In careful hands, it helps build health and resilience. Used carelessly, it can do the opposite. The choice and the control are in your hands. Now I'd love to hear from you. Do you usually eat your garlic raw, cooked, or as a supplement? And after watching this video, which habit are you going to change right away? Share your answers in the comments. Your story might be exactly what someone else needs to take better care of their health. If this video brought you value, tap the like button, send it to a family member or friend, especially those who eat garlic every day. And don't forget to subscribe to Ageless Vitality for more science-based health tips for seniors. Remember, lasting health after 60 doesn't come from trends or fancy gadgets. It comes from simple, consistent choices backed by science, like using garlic the right way. Stay well, stay strong, and I'll see you in the next video.
Đang suy nghĩ